Anterior stromal puncture for toric IOL. Errors can occur while marking associated with smudging or fading away of dye during pre-operative reference axis marking. Anterior stromal puncture creates a point mark without any epithelial erosion, and the simultaneous staining helps in perfect and long-time retention of the dye. Thus, ASP stain stays for more than 48 hours. In case the need to re-rotate the IOL occur, there is no need to mark again. Dr. Fog. Fogging of microscope eyepiece and fogging of spectacles causes blurring of vision during surgery. Defogger solution used by divers in deep sea diving and by miners while mining on their protective goggles helped in solving this problem. Goat's eye were integrated with cataractus lens obtained from small incision cataract surgery were used for practicing phacoemulsification. But the decrease in cataract surgeries during COVID-19 pandemic affected this. So we thought of some artificial nuclei that resemble human nucleus in the form of soap pellet. Soap is a salt of fatty acid which is produced by saponification of fats. Goat's eye packed with cotton gauze is loaded in the mannequin head. Superior tunnel of 8 mm was made at 12 o'clock position. Anterior chamber entry with keratome was made. At 9 o'clock position, clear corneal entry. Staining of the anterior capsule by tryphan blue followed by injection of the viscoelastic. 6 o'clock position, side port was made. Depending upon the comfort of the trainee, capsulorhexis of 5.5 mm can be done either through the side port or the clear corneal entry. Phacoemulsification of the central nucleus was done, forming a crater. Soap pellet of 7.5 mm diameter was made using tryphene. Soap pellet was placed through the 12 o'clock position tunnel and sutured. Side port was made at 11 o'clock position and nucleus was trenched initially by cracking and emulsified subsequently. Low-cost, high-definition Raspberry Cam. Raspberry Pi camera is a fully functional Linux-based computer that can be fitted with a HD camera module. An adapter, which is portable and also small enough to mount the Raspberry Pi, can be fitted to the observer eyepiece. It has a better quality than the more expensive commercially available systems like conventional camera, and mobile phones is more portable and records videos in high resolution. 5-cent airway for patients to breathe easily during surgery. The lanyard that is thrown away after each conference can be reused in this manner. The one end of the lanyard is tied to the microscope and the other end is clipped onto the drape during surgery. It also has a sliding note to adjust the drape height. Locked-in switchboard. To prevent accidental switching off of OT refrigerators that store drugs requiring low temperatures by the OT staff, the refrigerator switchboard is locked in with a wooden box, thus maintaining the cold chain. A rod with marking can make your work easy. A metal rod with marking helps fix the table height and chair height for a specific surgeon with ease. This in turn helps in theatre flow and ergonomics. COVID-19 safe intubation hood. A simple structure made from PVC pipes and plastic sheets. This intubation hood will minimize the spread of micro droplets and aerosol while intubating and extubating the patient. OT trolley sanitizer dispenser. It is portable and foot pedal controlled. It helps in hand sanitization by the OT personnel at frequent intervals. Clutter-free OT table. OT tables often get messy by patients' case sheets lying on them. A clutter-free OT table can be achieved by fixing a simple side tray to it for keeping the case sheets and IOL. TAFE, Spring Action Apparatus for Fixation of Eyeball, is a robust, simple and economical device to solve the problem of achieving a formed and firm eyeball which is stably fixed in a holding device in surgical wet lab training. The spring action syringe generates vacuum and enables reliable fixation of human and animal cadaveric eye on the iron cylinder. The rise in intraocular pressure due to vacuum fixation can be varied as per need or nature of surgery. Magnifier screen. Magnifier screen is a simple tool that can be used to read fine prints of automated printouts and match IOL labels before cataract surgery without using presbyopia glasses by surgeons, thus making the time out before a surgery more convenient for the surgeon. Microscope simulator or simulator box. To avoid the confusion for patients to focus on the light during phaco and flax and help them focus, we have devised two simulators mimicking the light source of operating microscope and flax laser, which are shown before surgery to help the patients to know what they see and what they must focus. Subtenon LED. Subtenon LED for performing the subtenon's anesthesia where a clear view of block sight is imperative. The device consists of a headband to be worn around the head by the doctor performing the anesthesia. It has a white LED light in center. This helps the doctor to see the patient's block sight clearly